Hello, everybody. Welcome to this event where we're going to talk about the MRCS examinations and doing it with the Royal College of Surgeons in Ireland. We're going to talk a wee bit about the exam. I am Eamon Mackle and I am the consultant surgeon in Northern Ireland, and I'm the senior MRCS examiner for the Royal College of Surgeons in Ireland. We'll talk away about Part A and Part B, and then Mr. Padraig Kelly will talk about why you should consider sitting the exam with RCSI. In the exam, they test levels of knowledge, and the various levels of knowledge that we do look at. Do you know of something? Do you know the basic concepts? Do you know generally? And do you know specifically and generally? And the MRCS is split up into two parts, the Part A and the Part B. The first paper in Part A looks at levels 1 and 2, your basic knowledge and understanding, but not much beyond bookwork and general reading, your ability to elementary link cause and effects between basic sciences and clinical problems. The second paper in the Part A exam looks at level 3, deeper knowledge and understanding. You can demonstrate links and cause and effect, and you have a basic ability to define conditions and outline principles of management and the process of diseases. Finally, in the OSCE exam, you look at the level 4, your ability to do an in-depth knowledge and understanding, to demonstrate it, show that it can be applied to clinical situations, show how your ability to synthesize information, draw conclusions, explain complex conditions and processes, and make diagnosis and discuss the management in detail. And that you can now start to justify your conclusions and suggest alternative approaches. So for the Part A, it is the MCQ exam, multiple choice questions. And as I said before, split into two papers. Paper 1 looks at applied basic sciences. This is a 3-hour paper, and there are 180 single best answer questions. Paper 2 looks at principles of surgery in general. It's a 2-hour paper with 120 single best answer questions. They are marked as 1, and you have to have at least 50% in each paper to pass the exam. The structure of the Part A in the basic sciences consists of anatomy, physiology, and pathology. And you see it's split up into physiology. You can look at various things like general physiology, system-specific physiology, pathology, likewise general and system-specific. So then is the principles of surgery in general paper. And then they look at perioperative care, post-op management and critical care, surgical technique, clinical microbiology, emergency medicine, trauma management, principles of surgery, surgical oncology. How often can you sit the Part A exam? Well, it's sat in 3 times during the year, January, May, and September. This is an intercollegiate exam. So all 4 colleges hold exactly the same exam. It is done simultaneously worldwide, and you're allowed a total of 6 attempts. The Part B OSCE exam, it has a syllabus which is based on basic surgical sciences and clinical skills, which apply to all surgeons independent of their final specialization. So it doesn't matter what branch of surgery you plan to undertake, this will apply to all branches. And it's mapped to the intercollegiate surgical curriculum project. In it, there are 4 broad content areas that are being examined. Anatomy and surgical pathology, applied surgical sciences and critical care, clinical and procedural skills, and these include physical exam as well as technical skills, communication skills, giving and receiving information, and taking a history. Under the anatomy and pathology, there are 5 stations: 3 anatomy and 2 surgical pathology. And included in the surgical pathology stations, there may be some microbiology questions. Applied surgical science and critical care has 3 stations. 1 will be exploring a common clinical acute care scenario. 1 will be exploring interpretation and use of investigational data, which you're usually given before you enter the station. And 1 will be exploring interpretation and use of imaging data, to be shown, for example, an X-ray. Physical examination stations, there are 3. And these nearly always will have simulated patients. Under the clinical and procedural skills, there are 2 stations for procedural skills. 1 will be testing a common surgical skill, and you can expect to have in at least one of these stations knot tying or suturing, and 1 testing an aspect of patient safety. And both will be germane to the whole of surgery. So they're not just restricted to general surgery, the whole branches of surgery could be involved. When it comes to communication stations, communication involves both giving and receiving information. And there are 4 stations in this area. 2 of the stations will be history taking. And you'll have a patient to talk to and take a history, and you'll have a surgeon and lay examiner examining you for this section or marking you. There'll also be 1 where you give information, and that would be either to a patient or a carer, and you'll be giving them information, and likewise you'll have a surgeon and lay examiner. Then there'll be communication with a colleague, the so-called telephone station. At this stage, you'll be talking to somebody on the phone about a patient you have seen. We've had some questions that have been pre-submitted. First one is study tips for the MRCS Part A. There are various resources available, and Paula Kelly will talk about this later, what resources RCSI can offer to help you towards studying for Part A. I'm actually talking about question 3 at this stage, which is how much study time do I need to prepare for the MRCS Part A? And in this respect, you probably need at least 4 months of hard work getting ready for the exam. The second question was, what is the eligibility criteria to sit the MRCS Part A? To enter the examination, a candidate must hold a primary medical degree. A final degree certificate issued by university is required to submit an application, and this has to be an English copy or an official translation. Unfortunately, transcripts cannot be accepted. Where can I sit the MRCS Part A? The MRCS Part A is delivered by Pearson VUE, and there are examination centres worldwide. However, some degree of travel is required, as the majority of centres are located in larger cities. What stage of my career do I need to be in order to sit the MRCS examination? Some candidates will sit the exam immediately after qualifying or fairly soon after qualifying, and the advantage of that can be that they have not forgotten a lot of their basic sciences. However, the Principles of Surgery in General paper does require some clinical knowledge. Therefore, we would suggest that you sit the Part A in your first year after being a house officer, and that you would sit Part B in the second year. For more information or to register your interest in the exam, you can scan the QR code on the screen or access the website of the Royal College of Surgeons in Ireland. I'll now hand you over to Mr. Pádraig Kelly.
Thank you, Mr. Michael. Hello, everybody. My name is Pádraig Kelly. I'm the Associate Director for Operations and Planning in RCSI. Why sit the MRCS? The intercollegiate MRCS is the most recognised surgical qualification globally. In fact, over 8,000 of your colleagues sit the exam each year. Passing this exam validates your level of knowledge, experience, and competence to progress your surgical career. It's a career-driven surgical quality mark. It's the minimum entry requirement for many national surgical training programs and health systems. The use of the post-nominals MRCS and RCSI comes with membership and passing the exam, and you join a global network, and it offers you international mobility. But why sit the MRCS with RCSI instead of one of the other Royal Colleges? Well, the intercollegiate exam provides you with a globally recognised quality mark in surgery. There are a number of careers benefits to sitting the exam with RCSI. RCSI educates and supports a professional network of over 11,000 surgical fellows and members globally. We are not just a surgical training and examination body. We are a recognised professional body, and we are also a health science university with over 5,000 students globally. Sitting the MRCS with us offers a range of benefits to you. We offer Part A in over 160 countries globally. We have 4 global Part B hubs and have increased the number of places by over 50% in the past 2 years. Signing up to the MRCS with RCSI, you get free access to our affiliate members program. You get access to free comprehensive MRCS preparation resources. We also give you a range of discounts, including 20% off pass test for Part A and Part B OSCE resources. We have a suite of MRCS Part B OSCE preparation courses, and we also have additional courses and workshops that we have developed to support you in preparing for the MRCS and for the next step in your career. So I might talk about some of these resources. So with the free affiliate membership, you get access to a range of surgical anatomy resources. We found in the past that some candidates have struggled on the anatomy questions as part of the MRCS, so we've developed a suite to help you. We've also agreed a 20% discount with Cambridge University Press. So if you need to get additional reading material to support you, we have the 20% discount in place. We also, as I've said before, a 20% discount with pass test for their MRCS resources. We have access to exam-specific Xavier journals. So we have over 10 journals that are available to you that we've selected specifically to support you prepare for the MRCS, and these are free. Surgery Quiz is our MRCS preparation MCQ portal. So this has a range of MCQs to prepare you for Part A. We also have a range of surgical skills and science videos to support you. So surgical science comes in the second phase of Part A of the exams. And we found in the past that people struggle with science. This is what you might have covered in your year 1 or year 2 of your medical degree. So we have a range of resources in there to support you and to help you remember some of the basic sciences. And we've access to a number of online courses that are specifically developed to support you prepare for MRCS. As I've said, we have the 20% off pass test resources for Part A and Part B, and pass tests are the most globally recognised preparation resource for MRCS. We also have an MRCS Part B preparation course. We have 2 different formats, and we offer them globally. And finally, we recently developed a medical science and surgery program specifically focusing on pathology. So feedback from candidates in the past is that they've struggled with pathology and some of the science elements. So we've developed a range of free videos and lectures and tutorials for you to help, that are specifically designed to support you as you prepare for the MRCS. So RCSI membership is competitive. You enter a body once you pass the MRCS exam that has a range of benefits to you. So we have core benefits that are essential for your career development. So these are designed for you once you've passed the MRCS to prepare for the next phase of your career. We have your own portal with your own benefits, your own educational materials. We have a range of journals and publications, all that are free. You get offered opportunities to participate in the college and to network globally. And there's a range of other benefits, and you can get this by actually visiting our website. It's rcsi.com/surgery/membership. And my colleagues will put a link to this up in the chat. So some of you have submitted some pre-questions for us to answer. So why should I consider MRCS with RCSI over one of the other colleges? Well, we have a huge network globally. We have fellows and members in 89 countries, and I've given you a visual here on these maps. But we have 11,000 fellows and members. As I said, we're not just a surgical training body. We're a professional body, but we're also a really large health science university. So throughout our career, throughout the history of RCSI, we have been supporting and developing aspiring surgeons in their career, whatever that may be. So some people have asked, what is affiliate membership? So affiliate membership is the first phase of membership. It's pre-MRCS, so it's pre-membership. And effectively, it's designed to help you progress from your internship through to the next phase of your career and to pass the MRCS. So within it, we have a number of career supports that are there to help you get your next job or for you to move globally, but it's also to prepare you for the MRCS exam. So the MRCS is a validation of your knowledge and clinical skills. So we want to help you achieve this. So some people have asked, can you sit the MRCS in Australia? And the answer to that is yes. A number of you travel to Australia each year, and up to now you haven't been able to sit the MRCS. But we have a number of candidates who sit Part A each year with us in Australia, and that's growing every year. So Australia is definitely a place where you can sit the MRCS, and we've given a visual. We fellows and members, a lot of fellows and members in Australia, and we're encouraging people, if you are going to Australia for the year, maybe this is the year to sit Part A. And if you return to your home country, then maybe prepare for Part B. So we've got we've opened a new centre in North Africa, in Egypt, and we've a lot of questions of, do we have members in Egypt? So we have a lot of members and fellows in Egypt. Ireland has a strong relationship with Egypt, and we've a lot of Egyptian doctors working here. So we now have 2 Part B diets each year, and we have a large capacity for Part A in Cairo and in the other cities. Another question we got, do you provide MRCS Part B examinations outside of Ireland? Yes. So we've global centres, and we've based them regionally near transport hubs to help it. So we've exam centres in North Africa, in the Gulf region, and in Malaysia. And in each centre, we run 2 diets a year, but we've increased the capacity. Prior to this, each diet, we had 80 places, and we've increased that in most of our diets to 120 places. So in each of our centres globally, we run 2 diets a year, and we spread them out throughout the year. And where can I get more information on sitting the MRCS with RCSI? So I'll share a QR code after this, but you can simply go to the website that my colleagues will share on the chat function with you here. And if you'd like to register your interest, so the MRCS exam isn't open all years, the different time slots there. But if you'd like to register your interest to sit an exam in the future, maybe now isn't the time for you, you can link on this QR code, and we'll take your details and we'll keep in touch on you. And once we open a new diet or we're taking registrations, we'll let you know. But we'll also give you access to some resources that might help you prepare for your next exam. So I'd like to thank you for joining us today. This is as I said, this is a global session with people from over 56 countries who've registered for this today. And I'd like to thank you. And if you have any questions that we haven't addressed today, please put them in the chat function or register your interest, and we'll come back to you and answer as many questions as we can.